TRAPID-AMI, a prospective international study reported in the first ESC registry hotline, evaluated the efficacy of a 1-hour algorithm for diagnosing myocardial infarction using high-sensitivity cardiac troponin T.
The key findings of the TRAPID-AMI study is that also in this large multicenter cohort from 3 continents, the application of the 1-hour high-sensitivity cardiac troponin T algorithm is very efficacious. So 75% of patients can really be assigned rule out or rule in. The algorithm is safe because the negative predictive value is very high. It's safe because all patients received long-term follow-up, and the rate of mortality in those patients assigned rule out was extremely low.
In the Atlantic study, 1,862 patients with STEMI were randomised to treatment with ticagrelor together with aspirin and standard care, either in the ambulance or in hospital.
The conclusions are simple. There is no safety issue with an early administration of ticagrelor, and you will not improve probably coronary perfusion at the time of PCI, but after PCI you may reduce the ischemic complications of primary PCI, such as stent thrombosis. So for drugs that we want to use anyway in this type of patients, it would make sense now to say use it as early as possible.
In IBIS 4, 103 patients with acute STEMI received high-dose rosuvastatin from the time of their primary PCI to investigate, by intravascular and radiofrequency ultrasound, the impact this had at 13 months on atherosclerosis plaques in non-infarct-related arteries.
In the presence of STEMI, we can induce a significant plaque regression, but apparently we cannot achieve a reduction in high-risk tissue in necrotic core as measured by radiofrequency IBIS. So in summary, we can shrink the plaque in heart attack patients. However, it is apparently not possible to reduce or to change the plaque composition.
To evaluate the impact of nitric oxide inhalation on reperfusion, 250 patients with a first STEMI were randomised to receive either nitric oxide or oxygen for 4 hours.
If you inhale nitric oxide during an acute myocardial infarction, it is a safe approach and it could potentially offer benefit, but we need to understand the precise mechanism.